Welcome, children. We'll be starting today's class on immunity, human health and disease. It's a very important topic, and immunity is something which is very, very confounding in the sense बहुत मुश्किल होता है कभी कभी. बहुत सारे ऐसे पॉइंट्स हैं जैसे पैसिव इम्यूनिटी, एक्टिव इम्यूनिटी कहाँ पे है, किस तरह का टी सेल्स चाहिए, बी सेल्स चाहिए, कहाँ पे किस तरह का सेल्स की जरूरत है. और ये ह्यूमन हेल्थ एंड डिजीज सबसे मोस्ट इम्पॉर्टेंट टॉपिक होता है. लास्ट टाइम इन 2025, if you probably go through the question PYQ questions of just the last year 2025 questions, there were 5 questions which came from this chapter. 5 questions the 5 questions bandito. I will speak both in Kannada and Hindi in between because we will require as many as possible to understand this in both the local language. I come from Karnataka, so therefore we will do this discussion from RN NEET. I am Dr. Venkat, your coach. I took this coaching basically because I found the difficulties that NEET students had after I saw my daughter go through the NEET coaching and found a lot of lacunae in the coaching. उसके बाद में मुझे लगा कि बहुत सारा ऐसी चीज है जो मुझे बताना पड़ेगा. So parallelly, apart from your regular coaching, I request you all to probably look at important inputs that you get from RN NEET, which we will be posting then and then. You can join the live classes. We're planning to have more and more live classes as we go closer towards your exams. After October and November, we will have daily live classes, as a matter of fact, as more and more of you start joining in live. I request therefore most of you who would have probably just seen and joined in now, try to go ahead and look at as many as you, send this link to as many of your friends and ask them to join this link. Very, very important. This particular chapter on basically what we are going to do is human immunity. As an important part of it, let us first see straight away. Do you want to just do some PYQs first straight away rather than going to the chapter? Shall we just do some PYQs pele? I want to see how many of you want to say you want to do PYQs or go through the lecture first. How many of you want to do PYQs first? Let me know. Is my audio clear? Is my audio clear? Good, we'll start with some of the PYQs that we actually wanted to go through. Okay, so let's see this simple PYQs that we had. These are taken from Edurev, NEET Edurev, and a very useful tool for any kind of study revision. I request you all to go through this. NEET Edurev is a wonderful way by which you get concise material, lot of test questions. I have no financial interest in it, but I found it very, very hard. Very important that they are tough, but at the same time you ensure that you get to train hard. You can see that, right? Train hard. But it's not only so important that you just train hard, because what is more important is training hard and training smart. There is a nice video which we have put up on training smart, on how to get smart goals. See that small YouTube shorts and then follow it, like it, and also please share it with as many of your friends as possible. Let's see this interesting question here. First, straight away question from your NEET 2025. This was one of the questions from your NEET 2025, and it was an important question that was there as a part of your question paper. Neoplastic cells, characteristics of cells. So he's asking you what type of cells are neoplastic cells. Neoplastic cells. Now there is a small this one which we have created about neoplastic cells. You might have seen that there is a shots on what kind of cancer is caused by AIDS. AIDS causes what kind of cancer? What is the name? What is that? Please put it in the chat box. Put it in the comment box. I keep telling chat box. I'm used to the WhatsApp, right? So that's why I keep telling that. But do put it in the comment box. What kind of... We'll do some PYQs which are very interesting, and then we will go ahead and do this chapter on immunity subsequently in the next class. I know most of you might be watching the cricket match. It is interesting. India is going to win that for sure. But let us do some of these PYQs straight away. See, neoplastic cells. They're asking you neoplastic cells characteristic refer to. This was a NEET 2025 question. Okay. Now you know a mass of proliferating cells. Okay. Rapid growth of cells. Invasion and damage to the surrounding tissue. Those confined to the original location. Now, you know that neoplastic cell means anything that grows rapidly. So they are neoplastic means they are cancerous cells. They will tend to grow beyond their limit. So they are not confined to where they actually belong to. So if it is a liver tissue, it will tend to grow outside the liver. If it is, say, a stomach tissue, it will tend to grow outside the stomach. If it is an esophageal tissue, it will tend to surround the surrounding tissues, going to the larynx, the trachea, and the other places. So they are not confined to the original location. So this is wrong. Invasion and damage to the surrounding tissue is right. Rapid growth of cells is right. And it is a mass of proliferating cells is right. So A, B, and C are the correct answers. So the answer should be D here. Right. So that was a simple question here about this particular topic. Right. We then go to the next question. Good. Let's just see the next question that we have here. That was another interesting question which they had asked about CT scan and MRI, right? Yeah, so we'll just go through that question. Before that, let me just erase this. Right. So the next question that is there is on your screen here. He has asked specifically that which of these are correct? Computerized tomography, which of these is correct? They have asked this question. Computerized tomography and magnetic resonance imaging detect cancers of internal organs. To detect a cancer of an internal organ, what are the tests that are done? You do actually the CT scan and MRI. They help to detect the cancers of internal organs, right? So that is very important. Chemotherapeutic drugs are used to kill non-cancerous cells. Chemotherapeutic drugs means what? Drugs which are used for your killing the cancerous cells. If you want to kill the cancerous cells, that is what the chemotherapeutic cells are used for. So the chemotherapeutic cells are used to kill the non-cancerous cells. They used to kill not non-cancerous but cancerous cells. So that is a wrong statement. Interferon activate the cancer patient's immune system and helps in destroying the tumor. Interferons and interleukins, these are two main kind of compounds which will help to provide immunity. So that's called as an immunotherapy. What do you call that? Immunotherapy. So they are important. Alpha interferon are important for activating. Right. Chemotherapeutic drugs are biological response modifiers. Are they biological response modifiers? He is asking. Okay, which of these are correct? You need to tick only the correct ones. Okay, so the B is wrong. Okay, C is C is correct, you know that. D, are they biological response modifiers? Are they biological? So important thing is, what are they? Biological means what? Those that are produced normally by the body. Are these drugs manufactured biologically? No. You see, interferons, and these are compounds which are produced biologically. So the chemotherapeutic drugs are not biological response modifiers. They are given extraneously, that is, they are given from outside. They are not biological modifiers. So I will say D is a wrong one. That was a tricky one. In case of leukemia, the blood cells counts are decreased. Typically, what happens in cases of leukemia? Leukemia, what is leukemia? It's a blood cancer. It's a blood cancer basically wherein there is a abnormal number of white blood cells. Now there is a tricky thing here, that the leukemia could be either leukopenia, that means very less. In most cases that leads to severe infections and all. When there is an abnormal increase in cells of the white blood cells, okay, so you can call that as a type of a leukemia. So that could be either a lymphatic cell, okay, or a myeloid cell, that is that produced by the bone marrow. So if it is produced by the bone marrow, they are called as myeloid leukemia, and if they are produced by the lymphoid cells, they are called as a lymphoid leukemia. Okay, so there are two types of leukemia. So leukemia typically means abnormal number of white blood cells. Right, so therefore the answer in this should be only A and C. So the last one is also wrong. So only A and C. See, this topic about leukemia and these things are not routinely given in your NCERT book. But they do mention what it is. Leukemia is a type of a blood cancer. So therefore it's very important for you to pick out these and know what are the correct ones and which are the wrong ones. Okay, good. We'll go to the next question. We'll do some interesting NEET 2025 questions, first 5 main questions that we have had, right? And then we can then subsequently go through the further ones. Okay. After maturation, so the same thing is given here. Chemotherapeutic biological modifiers, incorrect. See that, right? So he has given here clearly that that is an incorrect statement. Because biological response modifiers are different types of therapies, including the alpha interferon, because they are biological, means produced naturally by the body, whereas chemotherapeutic drugs are external drugs. leukemia, the blood cell counts are decreased because in leukemia there is an abnormal increase of the white blood cells. So typically you call it as an increase in the number of white blood cells. Okay, right. Yes, right. The leukemia means increase in the number of white blood cells. Right. So that was an important point that you needed to make a note of. Right. Good. Let us see this next question that we have, which is important. After maturation in primary lymphoid organs, the lymphocytes migrate. Okay, they migrate for interaction with antigens to secondary lymphoid organs or tissues. After maturation, so that means initially they are telling that the primary lymphoid organs, the lymphocytes are formed. Then after that they migrate for interaction with antigens to the secondary lymphoid tissues. Is it right? Okay, like what? Okay, what are the primary and which are the secondary here? So basically you need to know what are the primary lymphoid tissue. The primary lymphoid tissue are typically the bone marrow. You know, bone marrow is a primary lymphoid tissue, right? Then what else? Which else is a primary lymphoid tissue where lymphocytes are formed? Typically from the thymus. Thymus is another important organ which is a primary lymphoid tissue. Where are the antigens coming to? They are coming to the secondary lymphoid organs through the blood. The antigens reach the secondary lymphoid tissues where these lymphoid cells will go and attack. So they are the lymph nodes, the spleen, and the Peyer's patches. So what do you see here? Right? So these choices, okay? The lymphoid tissue, spleen, the lymphoid tissue, and the Peyer's patches are all secondary lymphoid tissues. So that's what he is asking. Indirectly look at it. He has not directly asked you what are secondary lymphoid tissues. He is giving an explanation for it, that what is it that is happening. Where are these secondary tissues to which the lymphocytes are going to. So it makes your reading little larger, bigger. So but you need to concentrate and see to it that you can pick out the right answer. Okay, जैसे कि यहाँ पे दिया हुआ है कि secondary lymphoid organs क्या है? Spleen, lymph nodes, and Peyer's patches. Okay, so these three are the correct answer. Let's just check that out. Right, we'll erase them and then come back and check the answer. Yeah, he says B, C, D and E only. Correct? That's exactly what we said. B, C, D and E. A and B were primary lymphoid tissue, whereas these are the secondary lymphoid tissue. The spleen, the lymph nodes and the Peyer's patches. Where are these Peyer's patches? Where do you get these Peyer's patches? What are they? They are present, specified lymphoid tissue which is present in the small intestine. And what do you call them? They call them, okay, malt or galt. Mucus associated lymphoid tissue, okay, or also galt, gut associated lymphoid tissue. The maximum number of tissues, lymphoid tissue, which is abundant, maximum in our body, are these galt or malt. Okay, so this is a very important point which has been told, and we have covered this important topic also in your structural organization. In the structural organization of tissues, right? There we have talked about this very important point, and that we have mentioned about the role of these important tissues, the malt and the gut. Okay, right? All of you are understanding it, I guess. So please put it in the comment box about how it's going. Are you able to get the points, and are you able to revise these important points? So quickly you can see these questions, and then we can subsequently do the revision of the immunity in the next class, or probably in the next live session that we shall be having. Okay, jaldi karenge. Okay, let's go to the next question. Okay, which type of immunity is present at the time of birth and is a non-specific type of a defense in the human body? He's asking you. Right, now you people can see the question. Well, the answer is also seen there, but anyway, don't bother about the answer. See the question and learn it well. यहाँ पे ऐसे नहीं है कि आंसर दिख गया तो इसका मतलब नहीं है कि हमें पढ़ना नहीं है. We need to see understand the question and सीखना है. Which of the following types of immunity is present at the time of birth and is a non-specific type of defense of the human body? Obviously, it is a type of a innate immunity. What do you call it? Innate immunity. And what type of immunity is innate immunity? It's typically a humoral immunity. It is not a cell-mediated immunity. It is a type of a humoral immunity because it is acquired directly from the mother. But at the same time, what is it? It is a type of through the mother, it is the innate immunity. So the type of immunity present at the time of a birth is a type of acquired immunity and a humoral immunity, but it is not a specific. It is a non-specific type of a defense to the human body, and typically because the choice he has given one innate immunity also as your choice, so you need to write that as the answer. But if they ask a tricky question that what is this innate immunity? Remember that innate immunity is also a type of a acquired immunity through the mother. It is not, though typically you don't call it acquired, you call it a passive immunity. What do you call it? Not acquired. Acquired is basically when there is an antigen and the antibodies are formed to it, or there is a cell-mediated immunity against it, then you call it as an acquired immunity. Okay, so first time you have got infected, the next time you develop an immunity. That is acquired. Whereas innate is inherent, right? Because through the mother, through the placenta, the child got the immunity through the placenta. And this is a type of a passive immunity where directly the antibodies are coming from the mother to the child. So it's a type of a passive immunity. They have not given the choice passive immunity. They could be giving even passive immunity as a choice. So remember that passive immunity is another choice for this same question. Right. We'll just do a few more questions and then probably we'll then get back tomorrow for the detailed live session on immunity. Right, so here if you look at this important part that is being told here, that innate immunity, look at that, same thing as we discussed. Right, so we're just going to see and revise some more points from the same thing. Innate immunity is present at birth, non-specific. Acquired immunity develops over a period of time. Right, present at the time of birth, it does not target any specific pathogens. Okay, right, and what are the different barriers that you know? The physical barriers, yes, skin and mucous membrane. The physiological barrier, what are they? Which help to fight disease. Like for example, physiological barrier means barrier which helps you to provide control of infection due to presence of different secretions. Like the mucous membrane of the mouth, the saliva is formed from there. That tears from the eye, okay? Right. Also prevents microbial growth, and also acid in the stomach. These are the three things which will actually give you physiological barrier. So what are the physiological barriers? Three: acid in the stomach, tears, as well as the mouth. Okay, so eyes, mouth, and stomach. Remember that. Then cellular components. You know what are the different cellular components? WBC, especially the neutrophils, which are the polymorphonucleosides, lymphocytes, all these. And then cytokine barriers. Virus infected cells, okay, secrete proteins which are called as interferons. And these interferons basically protect against virus infected cells. Correct? So that other cells which are not affected by the virus get protected. So if there is a virus infected cell, that cell will then trigger the formation of interferons, which will go ahead and protect other cells from the virus infection. So such a barrier is called as a cytokine barrier. Okay, right. So you got the cell-mediated immunity and humoral immunity, which we already discussed. We told about that. What is the difference between a cell-mediated? It is acquired through the T cells, right? And that helps you to basically protect the macrophages, the mast cells. All these play an important role in the T cell immunity, right? We'll go to the next question. Interesting question, that is, this is also part of your NEET 2025. Identify the statement that is not correct. So same here, again on antigen, on immunity. See the number of questions that they have asked on immunity. Almost you had 2 questions on immunity, 2 or 3 questions on immunity. Okay, so which of this is not correct? So read that properly. They have even made it in bold letters for you this time. Okay, now antigen binding site is located at the terminal end of the antibody molecules. Okay. Okay, where is the antigen binding site located? Is it located at the C terminal? You know it is located at one of the terminals. Okay, if you remember the antibody structure, you will come to know whether it is at the C terminal or at the N terminal. Okay, so each antibody, you know, has got the light chain as well as the heavy chain. Okay, and there are 2 identical heavy chains and 2 identical light chains. Okay, and then what are the thing? The antigen binding site is present. What is it present at the N terminal? N terminal basically is your antibody presentation site, whereas antigen presenting site is your C terminal. The C terminal is your antigen binding site. So one end of it is your C terminal. We'll see the picture and we'll come to know that it is the C terminal, which is the antigen binding site. Now each antibody, you know, has a light chain, right, and a heavy chain. There are 2 heavy chain and 2 light chain. Okay, so equally important. Then constant region of the heavy chain and light chains are located at the C terminal as of the antibody molecules. Okay, he is asking you which of this is not correct. Okay, so antigen binding site is located not at the C terminal but at the N terminal, right? And antigen binding site is located at the N terminal. So remember that antigen binding site is located at not the C terminal but the N terminal. So therefore that is wrong. Okay, the constant region has the light chain as well as the heavy chain, and that is located at the C terminal, right? So that is why it is called the C terminal constant region. Each antibody has 2 light and 2 heavy chains, right? And the light and chains are held together by the disulfide bonds, which is also right. He has not here asked the number of disulfide bonds. They even ask you the number of disulfide bonds. Between the heavy chain and heavy chain, how many? Between the light and the heavy chain, how many? Right? So, please see the picture again and remember how many disulfide bonds are there at each of those points. It's a very important part. We will revise that in our immunity lesson, which we are going to do subsequently tomorrow. Okay, so there is a simple match the following. This is a 2024 question. We will come to that subsequently later. Let me see if anything is there on top that we need to take care of. Right, nothing else there. Right. So these are the 5 questions in the 2025, and this is a question from the 2024. Well, you can do this question right away, and then we will probably call it a day today and then come back for the detailed lesson. This was a trial live recording, so that just for me to get familiar with the live processes. But we will try to do more of these so that more of you can then join in subsequently. Thank all of you who could join in today. Was wonderful, and we'll just see to it that more and more of you are able to join in, because these are all very important points which we are going to cover. Let's do this one question from NEET 2024 paper. Okay, so common cold, he has given you 4 things. You need to basically see between that and the list 2, which of them matches, right? So we will just go through that. I hope it's visible clearly. Yes, better now. Right. So common cold, hemozoin, Vidal test, allergy. You know Vidal test straight away here. Vidal test is for typhoid. These are simple questions. These are all last year questions. Simple, straightforward. You know, they would give 1 or 2 very tricky, simple ones. You could easily get 1 or 2. You will know the match the following of all. But the 2025 was not like that. You're not going to get simple match the following like this. You're going to get big detailed words, longer sentences, and you need to read them more, and then you need to be very, very quick in trying to identify. Okay, Vidal test is, you know, typhoid, right? Allergy, dust mites will give you allergy, right? Common cold is caused by a virus. You know, it's a virus infection. It is rhinovirus. And you know, Plasmodium is basically produces hemozoin. So therefore, that was a very simple one here to say which was the answer. D was 4, and then you know C is actually 2, right? So D4, C2. These 2 were right. B is 3. B is hemozoin is 1. B is 1. So therefore, the third answer is the right one. Correct. Right. So that makes it this a very, very simple problem. We will see more of this subsequently tomorrow in the live NEET class. We will be doing this chapter on immunity. We will be doing straight away some important concepts on immunity. Remain logged in. We're going to be doing that very important topic subsequently. Again, interestingly, we shall do one part of it again tomorrow. Very good. Thank you all for being there, and let's look to more of you to join subsequently. Thank you. Shubhratri, Shubh Khair. Read well, be smart. Smart preparation is very important.